Hello, I'd like to welcome you all to the ADN program at Somerset Community College. I'm so excited that you've chosen to attend SCC, and I'm excited to get to know each and every one of you. Um, I will try to go through this lecture online. It makes it a little bit unusual or awkward, when you can't actually see someone face to face, but we will do our best to um, portray what we need to get across to you, and I hope that you get what you need out of the lecture. If you have any questions at all, don't hesitate to reach out to me by email or phone, and I'll do my best to answer it for you. We are going to start with Chapter 1 in your fundamentals textbook. And this is a list of a few of the objectives. Basically, nursing is both an art and a science. You don't see that in any other professions, basically. Nurses have to have a body of knowledge they have to acquire from education and through school, but then they also need to learn how to provide that care in a way that comes across as caring, along with the scientific knowledge. And nursing is continually changing and growing. There are always new innovations and research coming about. It is our responsibility to stay on top of all of that and to learn all that we can about the new things coming along. But also, we need to bring an element of caring and compassion to our field. Nursing patients' healthcare needs are multidimensional too. We care for the whole person. Nurses are also involved in determining best practices for patient care, and it can be related to anything from problems with skin care to pain control, nutritional management, care of older adults, as well as younger adults, children, babies. There's a wide range of fields that nurses can go into. Always remember, though, that the patient's the center of our practice, and along with that patient, that includes their family and their community as well. So we have to keep all of that in mind. And I just had some pictures here of like where we've come from, some of the uniforms from in the past and how things have changed. Here's another picture in war times. Here's another one with the starch white, dresses and caps. And as you can see, in the past nursing schools, you didn't see a lot of men in those classes. Here's a picture too of them practicing their skills. And if you can see there, she looks like she's starting an IV maybe with bare hands. I know even when I started in nursing school, and I started in 1990, we didn't use gloves when we started IVs. We didn't wear gloves when we gave shots. So that much has changed. We we had needles for everything, and now there are needleless systems where you don't actually have to stick a needle into like IV lines and to get specimens from catheter bags and that type of thing. But even 30 years ago, we were not using gloves. That was right around the time that AIDS started to come about. I mean, it had been out before 1990, in bigger cities and that kind of thing, but we really hadn't seen that a lot in our area. But that really changed the bloodborne pathogens, the PPE, the standard precautions as far as including gloves for basically everything we do now. And again, this is just I don't know if that link even works. We'll just skip on through there. Here is from 1982, a picture of a class. And again, here's from the 1940s showing nurses' outfits and caps. Again, at that time, they were all white, very starched, very stiff, simplistic. Always had the caps, of course, and a lot of times the caps would be, they would have different symbols on them, or uh, stripes and things like that to signify which school they belong to and that type of thing. Here's another picture of a variety of caps. Here's some more of them. You can see on these where you have the different stripes, the different styles. They even put caps on men. I'm going to throw this one in there. This one's mine in my office. You might recognize somebody there. That was a long time ago. Looked like a baby. And then just another picture. And then, of course, got to put Nurse Jackie in there. I don't know if you all are familiar with her, but this is kind of how nurses are portrayed on television. And this is more how we're looking nowadays with scrubs. You rarely see the white starched uniforms anymore. Caps are by the wayside. You never see caps. So it's constantly changing, with the times. Of course, I had to throw this in there. This is how a lot of people think nurses look like, but no, thank you. And then, men are becoming more prevalent in the nursing field now as well. And that's good to see. There's a variety of jobs, different things nurses can do. She looks like she's doing maybe some telehealth or, maybe some triage or something like that. Again, there's another male nurse and the scrubs in the background. Nurses have even portrayed movies, that kind of thing. And this picture just kind of reflects some of the toll that nursing takes on a person, and stress and, emotional toll. And then that doesn't work either. We'll just go on to the next one. Like I said, nursing is a dynamic field that's changed over time. The nursing profession really started taking off in 1860, and that's when Florence Nightingale opened the first nursing school in London. Excuse me. Then in 1873, the Bellevue Hospital School of Nursing in New York City was founded. This is the first nursing school in the United States. And then up until the early 1900s, men actually dominated the field. They were in about the mid-1800s, women weren't allowed to be nurses. But during the Civil War, of course, the men were fighting, so female nurses had to pick, from there, and were in the hospitals and taking care of people then at that point. And this is kind of some questions to ask yourself, what exactly does a nurse do? What are the different kinds of nurses? How do I become a nurse? Who were some nurses in history? And we'll go over this as we go through the lecture. As far as history of nursing, again, this is Florence Nightingale, and she established the first nursing philosophy, and it was based on health maintenance and restorations. She developed the first organized training program for nurses. It was called the Nightingale Training School for Nurses at St. Thomas's Hospital in London. She volunteered during the Crimean War in 1853, and she traveled the battlefield hospitals at night, and she would carry a lamp as she went to these hospitals. And so that's how she became known as the lady with the lamp. I know years ago when I graduated nursing school, that was actually part of our pinning ceremony. I don't know if y'all have heard of the pinning ceremony, but that's like when you graduate, that's something the nursing program does to acknowledge graduates, and they give you a pin with the school's name on it. And then at that time, when I graduated, you also cap, so it was called the capping and pinning ceremony. But we carried a small lamp that looked like kind of like a genie's lamp, I guess, with a candle on it, and that was part of our ceremony. So it all kind of came back to Nightingale. But because of her improvements in sanitation, the mortality rate at the hospital in Scutari, Turkey was reduced from 42.7% to 2.2% in 6 months. And mainly that was just because she recommended hand washing, just for the doctors to use, like in between each patient, or the nurses that were caring for patients to wash their hands. Because like I talked about earlier about the changes I had seen, from not using gloves, wearing gloves. Well, at that time, it was even thought to wash your hands in between patients. So she thought that might play a part in, the transmission of disease and infection. And she was right, because it did make a big difference in the infection and the mortality rate. And then the next person we'll talk about is Clara Barton. She served during the Civil War. And this really helped to stimulate the growth of nursing. Clara Barton was the founder of the Red Cross. She tended to soldiers on the battlefields. And then another important figure in nursing was Dorothea Lindy Dix. She organized hospitals and oversaw and appointed female nurses, and she helped to organize and regulate supplies to the troops. Mary Ann Ball, which is also called Mother Bickerdike, she organized ambulance services, and she searched the battlefields at night looking for abandoned, wounded soldiers. And then Harriet Tubman, I'm sure most of you all have heard of her. She was instrumental in the Underground Railroad, but she was also an Army nurse. And Mary Mahoney was the first professionally educated African American nurse. Isabel Hampton Robb helped found the Nurses Associated Alumni of the U.S. and Canada in 1896. And this organization then later became known as the ANA, or the American Nurses Association, in 1911. She also helped to author many nursing textbooks, and she was one of the original founders of the American Journal of Nursing. You will see that often, and you may even encounter that or use that for research when you're doing your article review. In 1893, Lillian Wold and Mary Brewster opened the Henry Street Settlement, which focused on the health needs of poor people who lived in tenements in New York City. They were some of the first nurses to demonstrate autonomy in practice. They had to use quick thinking and problem solving without the supervision actually in the field with them of a healthcare provider. That was, I guess, sort of the beginning of health nursing. So you see that, still true today, where home health nurses have to be more autonomous, or, more thinking on making decisions, of what the patient needs out in the home without anyone else, there supervising them. And then this is Mary Breckinridge. She was very instrumental. She helped to shape nursing education in the 20th century. Nursing education moved to U.S. universities in the early 20th century under Mary Adelaide Nutting. In 1906, Nutting became the professor of nursing at Columbia University Teachers College. And then nursing specialties began to emerge by the 1920s. However, organizations supporting these areas would not develop until the 40s and 50s. And again, these can include the American Association of Critical Care Nurses, the Association of Operating Room Nurses, the Infusion Nurses Society. You all will hear more about that as you progress in your program. The Emergency Nurses Association. In 1990, the ANA, or the American Nurses Association, established the Center for Ethics and Human Rights. An interesting thing here about Mary Breckenridge, she established the Frontier Nursing Service. They went around on horseback and helped provide care to people in eastern Kentucky, and they were nurse midwives. They helped to lower the maternal mortality rate in Leslie County to less than the national average at that time. The Frontier Nursing Service staff started the precursor to the American College of Nurse Midwives. The Frontier Nursing School is still in operation, and it's located in Hyden, Kentucky. I'm sure you all may have heard of that. Becoming a nurse begins with education. Today we face multiple challenges as a nursing profession. Nurses and educators are revising nursing practice and school curriculums to meet the ever-changing needs of the society. So that's constantly something we are, trying to stay abreast of. COVID-19, for example, it placed a tremendous strain on the profession. It forced a lot of innovative teaching strategies to emerge. Like with having to go online, with doing simulations online, clinical case studies, and it's taught us to be much more flexible and, like I say, innovative and trying to find, teaching strategies that will provide the education that is needed. Advances in technology and informatics, and of course the aging population, the high acuity of patients in hospitalized or hospital settings. Acuities like the type of care that they need, like they're really bad sick. High acuity has more needs, requires one-on-one nursing, that kind of thing. So the people in the hospital are sicker than they have ever been before. And then discharging people earlier than we ever had before. So early discharge from healthcare institutions. These require all the nurses in all the settings to have a strong and current knowledge base, from which to practice from. So again, we will go more into detail as we go along on, continuing education and the part that nurses play in governance in the organization and laws and the power that nurses have. Healthcare reform not only affects healthcare as paid for, but how it's delivered. There will be a greater emphasis on health promotion, disease prevention, and disease management in the future. I guess, that helps with healthcare costs. If you can keep patients healthier to begin with and prevent illnesses from occurring, then of course you're going to decrease those costs. More services will be in community-based care settings, and again, that's a more cost-effective way of managing someone is in their home or through a community clinic as opposed to an inpatient setting. As a result, more nurses are needed to practice in these community care centers, schools, and senior centers. This requires nurses to be more adept at assessing resources, service gaps, and how patients adapt to return to the communities. The challenge is to use healthcare and patient resources wisely. Caring for the medically undeserved population is a global issue. The social, political, and economic factors of a country affect both access to care and resources to provide and pay for those services. Nurses also play an active role in emergency preparedness, participation in vaccine research, decontamination in times of biological attack, triage casualty to participation in crisis response units. Nurses are faced with multiple issues, hazards in the workplace, such as back injuries, repetitive motion disorders, and workplace violence. I talked a little bit about that in orientation, about the injuries and the repetitive motion. Nurses does take a toll on the body. There's a lot of lifting and turning. And one thing that I have seen that's a positive in the last few years is that they're coming out with a lot more devices to assist, like with pulling patients up in the bed and turning them and keeping them in the correct positions and that type of thing. The beds that are more accommodating for heights and things like that. I have seen a big change over the last, several years, and that helps to save, the nurses' backs and things like that. It is always important to maintain those body mechanics at all times. Like I say, when you're young and you feel strong and healthy, you may not realize that you're not performing those motions in the correct way. You will notice over time if you don't that you'll be paying for those things. That's for sure. So keep that in mind. And if, like I said, workplace violence is becoming more. I don't know if it's happening more, or if we're just more aware of it now. But from visitors, patients, etc. So it's always something we need to be aware of. And usually, most places you would be employed now, would have policies and procedures on what you do in that situation. And then there's the nursing shortage. The nursing shortage affects all aspects of nursing. It affects patient care, administration, nursing education. But it also prevents challenges and opportunities in the profession. So I'm sure I have read lately that there is, of course, there's almost always a nursing shortage. There's always a need, but I have read that there is anticipated a greater need after this COVID situation because the nursing population is getting older, and a lot have opted to retire, or of retirement age, and so there's that big gap to fill. So with fewer nurses in the workplace, it's important that we need to learn how to use our contact with our patients, our time that we have with them efficiently and professionally. And as far as professionalism goes, nursing is a profession. The people before us, the nurses before us in years past fought hard to get that recognition and to get, nursing seen as a profession. A profession has specific characteristics. A person who acts professionally is conscientious in actions, knowledgeable in their subject matter, and responsible to theirself and others. This means that as a nurse, you administer patient-centered care in a safe, conscientious, and knowledgeable manner. Again, we possess the following characteristics: an extended education of members and a basic liberal education foundation. So like I said, we have that basic knowledge, our Englishes, our maths, our histories, all those prerequisites that you had to do. And then, of course, we have the extended knowledge with our actual nursing classes. We have to have a theoretical body of knowledge leading to defined skills, abilities, and norms, provision of a specific service, autonomy in our decision-making and practice. And again, I talked about autonomy, and you're going to hear that over and over in this program. And that's where you learn to think things through for yourself, to make decisions on your own. And like I said, just to think for yourself mainly. And then we have a code of ethics for our practice. Nursing shares each of these characteristics and offers an opportunity for the growth and enrichment of all its members. The different educations of nurses. A licensed practical or vocational nurse is educated in basic training of basic nursing techniques and direct patient care. Now, the licensed practical nurse, or LPN, or the licensed vocational nurse, you may hear it called LVN, is a nurse who's completed a practical nursing program, and they have to pass a licensure exam. It's the NCLEX. That's the NCLEX for PNs. The LPN or LVN does practice under the supervision of an RN or other licensed person. The responsibilities and scope of practice are set by each state board of nursing. So that's something like, say, if you went to a different state, it may be different, but if you're wondering what an LPN can do here in Kentucky, that's posted on the Kentucky Board of Nursing website. An LPN or LVN, or in Canada, an RN assistant, generally receives a year of education and clinical preparation in a community college or other agencies. Some RN programs allow LPNs to enter the program at an advanced level. There's various educational routes for becoming a registered nurse. Right now in the United States, a person becomes an RN by completion of an associate degree, diploma, or baccalaureate degree program in nursing. I have not seen many diploma RNs lately. I know years ago that was a big thing. There were several of them, but I have not seen many lately. The Canadian Nurses Association has identified the baccalaureate degree as the entry to practice standard for RNs in all provinces except Quebec. We are starting to see that now. I know when I graduated, and like I said, that was many, many years ago, at that time they talked about that a bachelor's degree would be necessary, to practice within a few years. But like it didn't take off as quickly as I guess they assumed it would at that time. But probably in the last 5 to 10 years, we are seeing it much more too. In this area, recommending if you have an associate's degree to go on and get your bachelor degree. A lot of times, though, the ADN program is the way to go. You go on, you get your RN, you can go ahead past boards and be working, and then go back and get your bachelor's degree. You can get it with all online classes, and it doesn't take the time that it would take, if you went straight through to a 4-year program. And a lot of employers offer tuition reimbursement and that type of thing. So that's just something to keep in mind. Some roles for registered nurses require advanced graduate degrees. A master's degree in nursing is for RNs with a Bachelor of Science in Nursing, or BSN. For nurses that are seeking roles as a nurse educator, a nurse administrator, a clinical nurse leader, nursing informatics specialist, or an advanced practice registered nurse. There's also roles within nursing that require doctoral degrees. Right now, there's 2 doctorate degree options for nurses. There's the Doctor of Philosophy, or PhD, and it has a focus on research. And then there's the Doctor of Nursing Practice, or DNP, and this is a focus on advanced clinical practice. As far as nursing, the DNP or PhD is it's like the end degree. That's as far as you can go in nursing as far as education. Nurses with doctorates advance the profession by promoting evidence-based practice, conducting and disseminating research, developing and testing theory, educating future nurses, and influencing public policy and healthcare planning. Continuing education programs are a way to maintain current knowledge and acquire new knowledge. You will find, and we will talk more about this as you move through the program, that when you graduate and you pass NCLEX, you are required to participate in so many hours of continuing education service to maintain your licensure. So continuing education programs involve formal, organized educational programs that might be offered by universities. Your hospital where you work may provide these for you. You can find continuing education through State Nurses Association or professional nursing organizations. These often, like I said, provide some type of continuing education credit. And then in-service education programs are provided, with the healthcare agency or institution where you work. And then professional nursing practice and knowledge have developed in part through nursing theories. global views that help to describe, predict, or describe activities for the practice of nursing. Theoretical models provide these frameworks for how nurses practice. Most everything that we do today can be attributed in some way to a nursing theory that there's developed, many, many years ago. They are constantly, like I said, being utilized and maybe tweaked upon, and new theories coming about. The ongoing development of nursing theory or nursing science involves generating knowledge to advance and support nursing practice and healthcare. Nursing is a service profession, and we are a vital and indispensable part of the healthcare delivery system. Nurses in practice today maintain a consumer and service-based focus. As a nurse, we'll work with the patient and the family. We'll try to individualize care by trying to incorporate the patient's preferences and expectations. And again, the autonomy is essential to professional nursing and involves the initiation of independent nursing interventions without medical orders. Autonomy means that a person is reasonably independent and self-governing in decision-making and practice. And the way you reach this autonomy, of course, is through experience, advanced education, and the support of an organization that values the independent role of the nurse. Accountability means that you are professionally and legally responsible for the type and quality of nursing care that you provide. To be autonomous and accountable carries the responsibility to keep current and competent in nursing and scientific knowledge and skills. So like I said, that's one reason we do the continuing education. You try to stay on top of the newest, latest information and ways of doing things, and to keep your skills current. Nursing has a code of ethics that defines the principles that nurses use to provide patient-centered care. In addition, nurses incorporate their own values and ethics into practice. The ANA's Code of Ethics for Nurses, with interpretive statements, provides a guide for carrying out nursing responsibilities to ensure high-quality nursing care and meet ethical obligations. At the end of this slide presentation, I did provide you all a copy of the ANA Code of Ethics for you to look over. Okay, we got just a quick little quiz here to quiz yourself. Nursing is defined as a profession because nurses, A, perform specific skills, B, practice autonomy, C, utilize knowledge from the medical discipline, or D, charge a fee for services rendered. And of course, that answer is B, practice autonomy. Okay, and how do we go about then developing this professionalism in our career? These are some things that we need to consider and that we need to do in order to present ourselves as a professional. Professionalism in behaviors and appearance are critical to earning that recognition and respect as a nurse. Again, like I say, if we approach it carelessly, and I think I talked a little bit about that in orientation, basically you're always representing yourself. So if we don't present ourselves respectfully, then we're probably not going to be treated with respect. So try to keep that in mind. Your uniform as a student and practicing nurse should follow your agency's dress code. You should be clean and it should fit appropriately. Social media, that's something that, we're having to deal with now that wasn't even around when I first was in nursing school, but that's definitely something now that's very prevalent. So we have to be aware of that and the use of social media and when it's appropriate and when it's not appropriate. Social media can have positive results, by providing patient education, providing communication, and fostering personal connections. But inappropriate use can violate legal, ethical, and professional standards. Research has shown that there is an increasing number of incidents of nursing students and practicing nurses posting unprofessional content, such as patients' personal health information on social media sites. And that's a HIPAA violation. We cannot put anything on social media that has anything to do with a patient, even if it doesn't specify a name, if you give details about, I took care of this patient today and they had blah, 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 that's enough information that someone could figure out who you're talking about and you could violate HIPAA. Cyberbullying is also something that's occurred between both peers and faculty. And again, a lot of people are very brave behind the keyboard and may say things that they wouldn't say in person, so we need to be careful about what we are posting. Follow agency or school policy as well as the social media guidelines that are established by the American Nurses Association and National Council of State Boards of Nursing. Like I said, it's become so prevalent that even the ANA has come out with guidelines. Display professionalism when applying for nursing positions. Professional communication dictates that you send a cover letter when you're submitting your resume, thank you letter for the interview opportunity, and a resignation letter if you're leaving a position. And again, that's another thing that doesn't get done as often as should. If you are resigning, if at all possible, and you can give a notice, that's what you need to do. Like I said, you're always, even in there as a student, you're thinking, okay, I may want to work here. This is like a job interview. If you're leaving somewhere, again, most times don't try to burn bridges when you're leaving. You never know when you might want to come back. At the time, it may seem like I don't want to, I'll never be here again, but you never know. Maybe the time you do want to come back or need to come back. And you need to be professional even in leaving somewhere. For your interview, you need to dress in professional clothing. Don't wear scrubs when you come in for an interview. Be prepared for the interview. Be prepared to answer questions. There may be a question such as, how did you handle this challenging situation? They may want you to discuss your strengths. Maybe they want to discuss your weaknesses and how you would improve on those. A lot of other questions might focus on, how did you prepare? How are you prepared in your education for this position? What experience do you have? That kind of thing. When you're in an interview, make sure that you turn off and put away all your electronics so you're not distracted by anything during the interview, and avoid eating, drinking, chewing gum during the interview. A lot of these just make sense, and I'm sure, it's something you already are aware of, but it never hurts to review those just so you know. And then nursing practice. You may have the opportunity to practice in a variety of settings. That's the good thing about nursing. It is wide open. There's so many different things you can do. It's one thing I've said about nursing, you can never be bored with it, because if you're upset and you don't like your job, that's your fault. You can find something else. And I have changed. I've bounced around to different things, and not always because I didn't like where I was. It's just sometimes, life dictates that you need a different type schedule, or you need, something else, or there may be, you're just interested in learning a different thing. And, I've worked in the nursery. I took care of newborns for years. And then I did home health and took care of elderly, the very elderly patients. And of course, now I'm teaching students. That never was something necessarily that I thought I would be interested in doing. But, like I said, life happens, things change, and the opportunity presents itself. And then, here I am. So, like I said, there's so many things that you can do. State and provincial MPAs establish specific legal regulations for practice. And then there's professional organizations such as the American Nurses Association, that helps establish standards or standards of care or practice as criteria for nursing care. And like I said, each state may have their own Nurse Practice Act. So that's why it's important to familiarize yourself with that. And again, you can find that on the Kentucky Board of Nursing website. And if you were to live in a different state, you need to review that if you're going to be working in that different state, because they may not all be the same. The ANA is concerned with nursing practice, public recognition of the significance of nursing practice to healthcare, and implications for nursing practice regarding trends in healthcare. In the United States, each state board of nursing oversees its Nurse Practice Act. So the Nurse Practice Act regulates the scope of nursing practice for the state and protects public health, safety, and welfare. This protection includes protecting the public from unqualified and unsafe nurses. And although each state has its own Nurse Practice Act that defines the scope of nursing practice, most of them are similar. In the last decade, many states have revised their practice acts to reflect the growing autonomy of nursing, minimum education requirements, certification requirements, and the expanded roles and scope of practices of advanced practice nurses. As far as licensure, in the United States, RN candidates must pass the NCLEX RN. And again, that's a standardized test for all candidates. So everyone across the United States graduates from an RN program will take the NCLEX RN. So you're not technically, you can't practice as a registered nurse until you pass the NCLEX. As of January 2015, new graduates of Canada's 10 provinces and territories must also pass the NCLEX RN to become an RN. Now, there are certifications available for RNs. So beyond the NCLEX, if you want to work towards an area of certification in a specific area of practice, you can do that. Like, I don't know if you've noticed on my credentials, you know, it says RNCMN, and what that stands for, it's RN Certified Maternal Newborn Nursing. So there is a certification exam that I took that was for, you know, it concerned maternal newborn type information. And in order to sit for that exam, you know, I had to have 2 years of experience in that area. And like I said, the test was a pretty intensive test. And in order to maintain that certification, every 3 years I have to reapply, and I have to have certification or continuing education hours over and above, you know, the ones that you have to just have for your licensure renewal every year. So there's tons out there. There's some for, you know, operating room nurses. There's some for critical care nurses, IV nurses. There's just a slew of those out there for certification. Three essential components of professional nursing are care, cure, and coordination. The care aspect is more than just to take care of, it's also caring about. Caring is relational and requires you as a nurse to understand your patient's needs so that you can individualize their care. When you promote health and healing, you're practicing the cure part of professional nursing. To cure is to help patients under their health problems and to help them cope. The cure aspect involves the administration of treatments and the use of clinical nursing judgment in determining whether that care is effective or not. And then coordination of care is organizing and timing medical and other professional services to meet the whole needs of the patient. A professional nurse also supervises, teaches, and directs all those involved in nursing care. So, like I say, you're coordinating that care between, you know, say the aides, the nurse, the physical therapists, the social workers. You're also teaching, you know, families maybe to help provide, say, wound care or something like that for a patient. So that is part of being a professional nurse. In the practice setting, it's important to have objective guidelines for providing and evaluating care. Standards of nursing care are developed and established on the basis of strong scientific research and the work of clinical nurse experts. Again, you're going to be hearing all throughout your nursing career about evidence-based practices. These are things that we do that have been tested and tried and researched as the best outcome for patients and the best practice, again, the best way of doing something for the optimum outcome. The purpose of a standard of care is to describe the common level of professional nursing care to achieve quality nursing practice. An organization sometimes adopts a general set of standards for nursing care, such as organizational protocols, policies, or procedures. That is another thing that you will see, each facility that you work in, or, whatever type of job that you're doing, will have their own policies and procedures, protocols. So even though you may know your Board of Nursing, your recommended standard of care, your Nurse Practice Act, you may want to also refer to your policies and procedures and protocols at your facility, because they may handle things a slightly different way, or following a different chain of procedures or something like that. So always familiarize yourself with your facility's policies. And again, responsibilities and roles of the nurse. You're a caregiver. As a caregiver, you help patients maintain and regain their health. You help them to manage their disease and their symptoms, and to attain a maximal functional level and independence while they're healing. You're also a patient advocate. It's our job to advocate for our patients and stand up for our patients and speak up for them when they don't have a voice. We protect our patients' human and legal rights and provide assistance in asserting these rights if we need to. You're an educator. That's one thing I thought about when I took this job. Like I said, I'd been a nurse for 28 years, or almost 28. And I thought, gosh, I don't know. I've never been a teacher. I didn't go to school to be a teacher. I went to school to be a nurse, But then the more I thought about it, I thought, no, I am an educator. I mean, I've taught many patients, many families, many new nurses that, trained under me. And so I thought, yes, as a nurse, you are already an educator. You explain concepts and facts about health, and you, describe how to perform activities and procedures, like for self-care activities for your patients. We reinforce learning, and like I said, we teach our patients how to regain their health. We teach families how to perform skills for our patients. If they're going to go home and have to continue dressing a wound or something like that, we're teaching them that. We're teaching patients signs and symptoms to look for when they go home, if they need to return to the hospital, or what to watch for to show that they're progressing like they should. We evaluate patient progress in learning. When we're educating, we're learning if they're understanding what we're educating. And again, the communicator part of it goes along with that. We have to be able to communicate clearly, because without that, it's impossible to give comfort and emotional support. We can't give care effectively or make decisions with our patients and families. We can't protect them, from threats to their well-being. It's hard to coordinate and manage care if we can't communicate with our other departments that we're working with. The quality of communication is a critical factor to meet all their needs, and to facilitate, like I said, community care when they go home. We have to be able to communicate with outside services and that type of thing. And also, we have to be a leader. We have to work with others to create a vision and make decisions and take actions to achieve this vision. We have to be able to assess situations and identify strategies for what would work in that situation. And of course, using the best evidence, using those evidence-based practice protocols. And we have to guide others too. We have to say, yes, I've studied this. You have to be able to support your decisions and, like I said, lead others in those decisions. And we have to be a manager. We talked about, communicating and coordinating care amongst different members of the nursing staff, or, personnel. So again, we're managing. That's being a manager, is coordinating that. We may even be put in the position where we're an actual manager of a floor, and that also includes responsibilities for budgets and staffing and organizing care in that way. The manager uses appropriate leadership styles to create a nursing environment for the patients and staff that will reflect the mission and the values of the healthcare organization that we work for. And then career development, we'll talk a little bit more about that. Nursing provides an opportunity for you to commit to lifelong learning and career development to provide patients the state-of-the-art care that they need. And again, the nursing profession offers many expanded roles and different kinds of career opportunities. Again, your career path is limitless. I mean, and you're never too old to learn. You're never stuck anywhere. You can always go on and learn more. The Advanced Practice Registered Nurse, or the APRN, is the most independently functioning nurse. There's 4 core roles for the advanced practice nurse. They can become a nurse specialist, or a nurse practitioner, or a certified nurse midwife, or a certified RN anesthetist. The clinical nurse specialist is an advanced practice nurse who's an expert clinician in a specialized area of practice. So they specialize, like geriatrics, critical care, pain, rehab, diabetes, that type of thing. Now, the nurse practitioner is an advanced practice nurse who provides healthcare to a group of patients. They usually work in outpatient ambulatory care or community-based setting. Although I know now they have like an acute care geriatric, I think it is. There are, and they work in the hospital, almost like hospitalists. But I can't remember the exact name. I know one of them is acute care geriatrics, I believe, where they can, like I said, work in the hospitals and not just outpatient settings. The major nurse practitioner categories, like I said, is the acute care, adult, family, pediatric, women's, psychiatric, mental health, and geriatrics. A certified nurse midwife is a nurse practitioner who's educated in midwifery and is certified by the American College of Nurse Midwives. This nurse can provide independent care for women during normal pregnancy, labor, and delivery and care of the newborn. Practice also can include some gynecological services as well. And then there's the certified nurse anesthetist. This is a advanced practice nurse who has advanced education in a nurse anesthesia accredited program. Nurse anesthetist provides surgical anesthesia under the guidance and supervision of an anesthesiologist. Then there's also the nurse educator position, and these nurses work primarily in schools of nursing, staff development departments, in healthcare agencies, and patient education departments. So like if you've been in the hospital and someone's come in and done discharge instructions with you, that might possibly be someone from the nursing education department. Sometimes one of those nurses may provide nursing education to the staff, like the CPR training, recertifications, things like that. Then there is the nurse administrator, and these nurses provide or manage patient care and delivery of specific nursing services within a healthcare agency. So like I said, that's usually one of the, like the CNOs, chief nurse officers, and people like that have usually obtained an education to become a nurse administrator. And then there are nurse researchers, and these nurses investigate problems to improve nursing care and further define and expand the scope of nursing practice. So like I said, these are some of the ones that help develop those evidence-based practice protocols and things like that. There's several professional nursing organizations. These organizations help us to deal with areas of concern for professional practicing nurses. The National League of for Nursing advances excellence in nursing education to prepare nurses to meet the needs of a diverse population in the changing healthcare environment. So they're over, these people kind of govern how schools of nursing are set up and curriculums and things like that. There's the ANA, and again, the purpose of the ANA is to improve standards of health and the availability of health care. They foster high standards for nursing, and they help to promote the professional development, general, and economic welfare of nurses. The ANA is part of the International Council of Nurses, and the objectives of the ICN are parallel to those of the ANA. They promote national associations for nurses, improve standards for practice, they seek higher status for nurses, and they provide international power bases for nurses. And then there's the Nursing Students Nurses Association. Nursing students can take part in these organizations. These consider issues of importance to nursing students, like career development and preparation for licensure. We have an organization here at SCC for student nurses, and you'll probably be hearing more about that as we go along. This is ran by our student nurses, so it's student run, student governed. It is called FLING, Future Leaders in Nursing Governance. And again, like I say, you will be receiving some information on this if that's something you'd be interested in joining. Some professional organizations focus on specific areas, such as, like I talked about earlier, critical care nurses, nursing administration, research, nurse midwives. These organizations seek to improve the standards of practice in those areas. And then in addition, the professional organizations present educational programs, and a lot of them publish journals, articles, that type of thing. Okay, we got another quiz here. The NLN and the ANA are professional organizations that deal with A, nursing issues of concern, B, political and professional issues affecting healthcare, C, financial issues affecting healthcare, or D, all of the above. And of course, that would be all of the above. They help with all of those things. Now, some trends in nursing. You'll probably hear about, I think they call it QSEN, or I've heard them call that, quality and safety education for nurses. The QSEN addresses the challenge to prepare nurses with competencies needed to continuously improve the quality of care in their work environments. So this initiative encompasses the competencies of patient-centered care, work in collaboration, evidence-based practice, quality improvement, safety, and informatics. So for each competency, there's targeted knowledge, skills, and attitudes. So this is sort of, we base a lot of our policies and procedures on these things here that we're trying to meet. As a nurse, you'll be affected by the emerging technologies found in healthcare. New technologies provide more accurate, non-invasive assessment tools. They help us to implement evidence-based practices, collect and trend patient outcome data, and use clinical decision support systems. So like I said, we're constantly seeing a new technology. It might be a new charting system. It may be, I know just like in my practice over the years, the EMARs come about, or like where you scan patients' ID bands and then scan the medications. That's a technology that was not around years ago. They're coming out with all kinds of new things constantly. So most of those hopefully are things that can help us to provide better care and safer, more effective care. The nursing profession will continue to evolve and grow. And so as individual nurses, we have to be willing to evolve and grow as well. Genomics, I can't pronounce that, is the study of all the genes in a person and interactions of these genes with one another and with that person's environment. Using genomic information allows healthcare providers to determine how these changes contribute to patient conditions and influence treatment decisions such as assessment and symptom management. And it may be even on titration of medications. That is something that we're starting to see. You can go and have your blood drawn and have your genes checked, and it may show that if you have a certain level on a certain gene, or whether you don't have, like the level is like non-existent on a certain gene, you may have a different response to some antibiotics than other people. Like you may not react in the same way. Maybe a pain medication, for example, does not provide the relief for you that it would for someone else because of a gene, something with your genes, you know, a deficit, or maybe not even a deficit, but just a different type of gene, and it doesn't respond to that. So it's very interesting, but that is starting to, come about. Again, some of the gene studies, you may show that you carry a specific gene for a cancer, and you'll find that out in advance, so that you may be able to modify some of your lifestyle behaviors, or you may know that you need to be screened more frequently or start earlier in life, screening for something that you are particularly prone for because of your genes. Or, like you may have heard with the breast cancer gene, if you're carrying that type of gene, you may opt to do a mastectomy prophylactically, before there's been any evidence of cancer, just because of your high incidence of it, or, susceptibility to it. So it's pretty interesting. Consumers of healthcare are more informed now than ever. Of course, with the internet, everybody can find out anything on the internet. So they have access to healthcare and treatment information. And this information affects the perception the public has for nursing. For example, the media frequently highlights incidents of preventable medication errors or surgical errors. Publications such as To Err is Human describes strategies for government, healthcare providers, industry, and consumers to reduce preventable medical errors. So, like I said, it's always important that we act in a competent, professional manner, but even more so when, they are educated somewhat as well from what they can find out on the internet. Nurses as a group are increasingly politically active. Professional nursing organizations at both and state level employ laws to urge state legislators and the U.S. Congress to improve the quality of health care. We can influence policy changes at all governmental levels. One way is to get involved by participating in local and national efforts. And here are some websites that you might want to look at and find out, some information about. Here is the Kentucky Board of Nursing.ky.gov. That'll give you the Nurse Practice Act. That will tell you everything you need to know about nursing in Kentucky. Requirements, licensure responsibilities, continuing education requirements, all of that you can find there. And again, I just wanted to show another picture of nurses long ago. And this is an example of a pin. We talked about earlier, you'll receive a nursing pin from your school. And as you can see on there, it tells, the name of the school. And then this is a website you can go to see different types of pins. This is a map of the United States, and it shows where the compact states are. Compact states, we'll talk about that too, is where, like if you're licensed in Kentucky, you can also work in Tennessee with that same Kentucky license. Now that's something that's changed since I've been a nurse. When I first got out, I went to work in Tennessee. That's where I started working because I live near the Tennessee border. And I had to also apply for the Tennessee license. I had to pay for it. So I had to actually pay for both. But now, like I said, in these that are red, it's my understanding they are compact states. So like if you're a travel nurse, you may just have one license here and then you can work in the other places. And regulation of nursing. This just talks about things that you do, how they keep up with the regulation. We've talked about that, the licensure, the standards of practice, and all of that. And again, if the differences in RN and LPN and what they can do, the best thing to do is look for scope of practice on your Kentucky Board of Nursing website, and it should tell you. And then, like I said, some facilities may have their own policies on that too. So that's something you need to be aware of when you're working, let's say, in a hospital and you may have an LPN that you're working. You need to know what medications they're allowed to give, or what they can access, what they can't, that type of thing. And then this is your ANA Code of Ethics, a list of those.